Now, globally, more than 4,000 people have died from the coronavirus and over 113,000 cases have been confirmed, according to the World Health Organization. 64,000 people have recovered around the world. While China's Wuhan city is ground zero of this COVID-19 outbreak, with a death toll exceeding 3,000, the virus is ravaging Italy. 168 people died in a space of 24 hours, bringing the death toll to 631. The whole of Italy, a country of some 60 million people, has been placed under quarantine as the government steps up efforts to tackle the coronavirus outbreak that has affected more than 10,000. Now, Willem Hifindaka, a Namibian who's in Turin, Italy, joins us now via Skype. Willem, good morning and thank you so much for joining us.
Glad to help.
Willem, just to start with, perhaps, could you give us an assessment of the situation there?
Right. The situation here in Turin, Italy is comparably better to most of that in the rest of the country. It's in the northern area of Italy. It's less affected, but there is a sense of general panic, a sort of muted panic. A lot of people are afraid and not quite sure what to do. The directives haven't been so clear. But really, life before this week has been relatively normal. It's only in the past week, this Monday, that the government announced new restrictions on movement and the opening of stores.
Mm-hmm. You're saying that life has been normal, more or less. So how has this virus generally affected your day-to-day life or even your studies, if at all?
Right. So the fortunate part for Italy, it's very technologically connected. So most services have moved to online platforms. People are working from home, mobile, remotely. And as for me, I'm also receiving my lectures mobile. I'm at home and then I stream them. But generally, the economy is taking a bit of a hit. So far, there have been implications for Italy in general, which was already at a high debt from what was announced by the president yesterday. But in terms of the quality of life, it seems to be going on, which has been one of the problems actually, because Italians are very sociable and they continue to socialize. So in my view, that has contributed to the spread of this disease.
The rate at which this virus has spread in Italy has really come as a shock to many. How would you describe the government's response to this outbreak?
Well, the Italian government has been quite lax, to be honest, quite relaxed. I came here just a week before this outbreak began, and in the initial stages, no serious measures were taken. I think that there was a misunderstanding of the situation, a non-appreciation of the situation, which allowed life to go on as usual. Now, the problem with corona, as we know, is that its incubation period is quite long. It can be up to 14 days or so. So the virus is being spread through public transport, the metro, the buses, through socialization just in general, and there were no real measures taken against it. But now, after the fact, the government has taken more stringent conditions. This past Monday, the president announced that stores, shops would be closed, would be curfewed until 6 p.m. And then yesterday, after the World Health Organization declared it a pandemic, all shops are closed except for supermarkets and pharmacies. So new measures are being put in place. Also, a general traveling restriction is in place between the regions. So if you want to travel from Piedmont, which is my region where I am, to Lombardy, the region of Milan, you would need written justification and authority from police.
Oh, wow. I understand that government has issued a nationwide lockdown. You just called Italians very social people. So are they adhering to these restrictions that's been put on them?
Well, now they are beginning to. In the beginning, at the start of the outbreak, it was very much a thing of, oh, this is very inconvenient for us. This is an extreme measure, even with those little measures which had been taken by the Italian government. So at that stage, people were still traveling around. As I say, they're very social, region to region, and carrying disease, presumably. At the moment, it's being taken much more serious. People are at home. People are encouraged to stay home and to avoid going to work. In fact, the government has suspended mortgage loans for certain businesses and certain individuals to take the economic burden off them. So, yes, people are really starting to adhere to it now.
As I mentioned earlier in the intro, in the space of 24 hours, 168 people have been killed by the coronavirus, which raised the death toll to 631. From your observation or from your point of view, what do you think it is that makes Italy so susceptible to this virus?
Well, Senna, like for the factors I've already mentioned, the socializing a lot, the response initially by the government, and then very importantly, Italy has an older population. So over 60% of the total population is over the years of, or the age rather, of 40 years. What we do know about this disease, of course, is that it affects people with weaker immune systems, which tends to be correlated to age. So that's really one of the issues that's happening now. The other problem now that we're seeing is that the Italian healthcare system is completely overwhelmed. They are unable to take care of these older patients. So before it was unconfirmed, but yesterday the president of Italy did in his address to the nation confirm that they're no longer going to prioritize people over 60 years in terms of respirators. So what that means literally is that the younger people who are determined or seen to have a better chance of surviving this virus are going to be given medical priority. In my view, that definitely contributed now to this death rate.
That is shocking, and for a country like Namibia, who hasn't had a single case of coronavirus here, when we look at what you've listened to what you've just said, Italy is seemingly being a first world country with better healthcare facilities compared to Namibia as a developing country. I mean, to make Namibians understand just how serious is this COVID-19?
It's extremely serious. It's extremely serious. While it is true that generally people with fine immune systems would be fine, the problem becomes exposing the vulnerable to this. So even a country like Italy physically just does not have the facilities to hold all these people. The other problem is that eventually Italy had no choice but to recommend self-containment, which means staying at home, which is unregulated. So in terms of Namibia, we should be really, really, really concerned in taking this seriously. It's definitely something that can cause a lot of loss of life. We do have, although it's not equitable to Italy, we do have a large older population. Yeah. And in addition to that, we do have issues of HIV and so on. Yeah. Of course, HIV weakens the immune system. So what I'm really saying is that we should take it very, very seriously. At this point, France has even taken measures against Italy economically. You would know that the Euro zone is an open trading zone, but France has violated some of those principles to limit imports to France from Italy.
Well, Willem, that's all the time we have this morning, but please do take care of yourself, adhere to all the precautionary measures, and we hope that you keep well. Thank you so much for talking to us this morning.
Thank you.
That was Willem Hifindaka, a Namibian student in Turin, Italy, speaking to us this morning about the situation in Italy. As we know, other than Wuhan, China, Italy has had quite a high number of infections and a death toll of 168 in 24 hours. He's just also mentioned that the healthcare systems and hospitals in Italy have prioritized